So I welcome all of you to the 13th episode of Scalpel series. And today's episode is going to be very interesting. We have a special guest with us. I'll introduce the guest, Dr. Swastya. She is an infertility specialist. And friends, today we are going to talk about infertility and obesity. You know how obesity is related to infertility, and what are the consequences, and even if you conceive, what are the problems during pregnancy. So it is something I feel it's very important topic. We are seeing nowadays lot of infertile couples who are struggling to conceive, and till now none of the open forums we do not talk so openly about infertility. There are still some taboos in the society. I feel people think it is bad to talk about infertility. Couples, we have seen couples who have been trying for conceiving, they are not able to conceive 2 years, 3 years, but still they feel that it's all right, and they do not open up, they do not tell their senior people in the house. So that is something that is very common. So I think it's high time we need to break this taboo, and it's really going to be quite interesting today, because we see so much of obesity, and with that they have infertility, and you people see so much of infertility, and often you see obese couples as well. So friends, today we are going to talk only about infertility and how obesity is related to that. So my first question, thank you so much once again for joining us. And my first question is what is the relation between obesity and infertility? So you can talk about first female infertility and then even males. Obesity is directly related to male infertility also, which probably we'll discuss further. That is something that is not discussed at all, in an open forums. So you can tell them about, relation between female infertility and obesity.
Yeah, definitely there is a direct relationship between obesity and infertility. Yes. So mostly it is been said like it is threefold higher chances of infertility in obese women than in non-obese. So what are the reasons why they land up into infertility?
So you feel it is 4 times more chances?
3 to 4 times
more chances of infertility in obese women.
Yeah. The reasons for what we say is they have irregular menstrual cycles. Again, they land up into anovulatory cycles, because anovulation causes infertility, and they can have other complications, like because of obesity there is a social stigma, they go into depression, right? And even if they get pregnancy, there are higher chances of miscarriage, and so many things do happen, right? So that is how even if they go for even assisted reproduction like IVF, the chances of conception is little less than the non-obese population.
So you feel that now you are telling so much of relation, see, we often see people who are hardly in their late 30s, and they tell they are having early menopause. Okay, so normally the menopausal age is around 40, 48, 49, maybe 55. And nowadays we see a lot of early menopause also. Like we recently had a patient who had anovulatory cycles, and they came very late for reducing weight. So she has lost 30 kgs. But then, do you think the anovulatory cycles change, or once it becomes anovulation or ovarian failure, probably early ovarian failure, do you feel that it stays like that, or losing weight there is any comeback of the ovarian function?
No, it is two different ways. Ovarian reserve is different, right? If the ovarian reserve is less, then chances of coming back is less. But obesity and infertility has definitely a relation, because it reverses if you lose weight. Definitely.
Okay,
and that helps for them to come with a natural pregnancy.
Okay.
So we have seen patients having losing weight, like even they lose 5 to 7% of their weight what is required, right? So their chances of pregnancy is good.
Yeah.
Chances of conception is good. Many times they come to us with a natural pregnancy if they lose weight.
So
that
if
is
you
very-
feel that if the ovarian reserve is not that great, then even if they lose weight, it is not going to help much.
to some extent, yes.
To some
but
extent,
yeah.
it may help. Because of late, we see a lot of patients, and when we tell them that, come down with the weight, there are a lot of patients who lose weight and they conceive normally.
Yes.
They conceive normally. Then we see a lot of youngsters nowadays, age group of 14, 15, they have just attained menarche, they have just started periods, but then they are so much of irregular, and so this particular age group, you feel that if they lose weight, especially the teenagers, the cycles will become normal?
Yeah, slowly over a period of time. Definitely, yeah, obesity plays a very important role in full lifestyle. Like if you change the lifestyle, like definitely if you lose weight, it helps in every angle. Right? Because if you see for example, women over 30s, over 40s, right, and those who are obese, they have every other things, like they're
Yes.
having cardiovascular problems, they
Hypertension,
hypertension,
diabetes.
diabetes, all that.
High
And
cholesterol.
even if a pregnant woman, for example, an obese woman is pregnant, for example, she may have higher chances of miscarriage. She may have higher chances of stillbirths, premature babies. Okay, they get blood clots, what we call it as thrombosis, right? And they get hypertension in pregnancy. And again, they get main important, they land up into gestational diabetes.
Yeah, we see so much of gestational diabetes.
Yeah.
Like all my patients, whoever I see them, like I see majority of the obese patients only, but everybody has the same history that during pregnancy they had gestational diabetes, and then they lose diabetes, but still they are obese. So then it's high chances that in future they will end up with normal type 2 diabetes.
Yeah, and those are in having gestational diabetes. They will have then other complications in pregnancy. They will have larger babies. They will have difficult labor, difficult deliveries. Like they can have C-section.
Yeah. No, now, one very important this thing I want to ask you. Now when you told that they end up in larger babies and everything, do you feel we see lot of children? Do you feel there is any relation with the mental development of the child with the obese mother versus non-obese mother? Is there any difference? Is there any relation?
Yeah, there may be,
Because certain things we have not studied. Probably there are no much data telling that because previous era, when we are seeing the previous age group, they used to get married early. They were like quite normal weights. Like when we grew up, it was like hardly 50-55 kgs was the norm. Okay. Here now I am seeing 75-80 kgs is the norm. Like I am not seeing anybody less than 75. So I feel that that also makes a little difference. Plus late marriages, late pregnancies.
Yes.
So lot of things I feel it's completely related. So friends, this is something very important what she has told, like especially the relation between infertility and obesity, and I think there are a lot of data telling that when your BMI, like see every time I talk about BMI, so you should be knowing what is BMI. It's a body mass index. Normally it should be less than 25. So whenever your BMI is above 30, okay, all this whatever she has told, all those chances are more. Even if you become pregnant, your chances of other complications during pregnancy are more. It can affect even the growth of the child, and even if you are trying for pregnancy, and if you have infertility and things like that, then whatever she told, all those chances are more when your BMI is above 30. Okay, now one more important thing, Dr. Swati, I want to know, is there, see, we don't talk about male infertility much. Whatever the people I see, I do sometimes see male patients also who wants, but they do not open up. So I want to know, is there any relation between obesity and male infertility?
Yes, there is definitely a relation. Obese men, uh, you will see mostly they will have low sperm count, low motility of the sperms. And again, they will also have the similar issues like they are depressed. And again, obesity, they may have a diabetes. If in diabetes, again, there may be erectile dysfunctions. And yeah, sexual activity is definitely low. So all these factors will really affect male partners as well. So that is also one of
No,
the
even
rising reason.
one recent data was telling, previously the sperm count used to be some 60 million per this thing, ml or something, and nowadays it has come down to 20 million. The sperm count. So the overall sperm counts are also decreasing. Over the last 3 decades, the sperm counts have come down. Okay. So I feel that yes, probably as she told, it can be because of obesity and stress related factors also. Nowadays there is a lot of stress at work also, so stress also, basically stress, obesity, everything is one cycle. Unless you control your stress, you are not going to control your obesity, and everything is interlinked, so it is more of stress, it's more of outside food and lifestyle changes. Previously we never had lifts, and we never had so much of mechanized things in the household work also. Now everything is automatic, so we don't have any other work. Okay, so that is the reason probably no physical activity much, so we put on so much of weight. And I feel it is high time we have to understand that obesity is something that it gives rise to all the problems. So I think people who are youngsters and who are trying to conceive, if you are not able to conceive normally after 1 year or 2 years, what is the recommendation? Like when do you stamp it as infertility? After 1 year, 2 years?
1 year. Yeah,
After
it is
1 year.
like, yeah, if they are
So,
in relationship for 1 year, and then if they are not conceiving, we do.
Then yeah, I feel that you should meet your doctor and try to find it out. Actually sometimes what happens, everything may be normal, just losing your whatever she told, 5-7%, maybe 10% weight, it will work wonders. 7% or 10% generally I tell people for obesity, because 10% weight loss will change your life. Even if you are a borderline diabetic, you will become non-diabetic, you will have more chances of conceiving, and even the pressure comes down, lot of other factors also will become normal. Okay, so if you are 80 kgs and trying to conceive, then 8 kgs is what is 10%. So probably if they come down to 72 kgs, then definitely that is going to help. And can you tell us little more in details, like suppose a high BMI person conceives and becomes pregnant. Suppose person's BMI is 35 or 40 BMI, and they conceive, then what are the complications during pregnancy that can happen for this type of people who are 35-40 BMI? So you feel that as you told previously, you told chances of miscarriages are more.
Yes.
So there is a relation between obesity and miscarriages?
Yes. So if they conceive,
Okay.
if you compare with a non-obese group, they have little higher chances of miscarriage.
So they have high chances of miscarriage.
If they
Then-
conceive,
yeah.
then there are higher chances, like they might have stillbirth babies, or they might have
Okay.
premature babies. as
Premature
well.
babies are more common in obese
Yeah.
individuals. Then gestational diabetes.
Diabetes.
Diabetes during pregnancy is more
Yeah.
common in obese individuals. Blood pressure?
Blood pressure might go high. So
Okay. So we call it as preeclampsia and things like that.
Preeclampsia, eclampsia, then
So
right?
all those
and they
chances
might
are
have
more.
high chances of blood clots, means thromboembolisms.
Okay.
And definitely gestational diabetes.
Yeah,
very
so
common.
this is something that is very important for the common people to understand that, see, you may conceive also with whatever your weight is, but then I think if you are above 30 BMI, then at least you should try to bring down your BMI and then try to conceive. I feel
Yes.
that is much safer.
So
You
pre-counseling.
will know, yeah. So pre-counseling is something very
Before
important
conception.
before conception. So I think that's why this this thing has come up, and I think it is a good idea of having pre-counseling before getting into pregnancy. So friends, this was something that was very important. I think if you are on an overweight side or an obese side, then I think it is high time that you should look into your weight, try to come down with your stress related factors. And one more important message I would like to give to the audience: you please get into a scientific weight loss program. Meet your doctor, meet your GP, whoever is there, and please ask them how to come down with your weight, because I am seeing a lot of people who just do crash diets and some fancy diets looking at the internet, and they often end up in problems, they often end up in other complications. Okay, so you should get into something which is scientific, which is proved, which is FDA approved. So I think that is something that is very important. And one last question I would like to ask you: is there any message to the teenagers? Like, we see a lot of teenagers who put on weight and they have irregular menstrual cycles, and they suffer sometimes, and they are not able to open up. They do not tell much. Out of depression, they try to eat more. They often, I see people ordering from Swiggy and Zomato. The younger generation, they don't want the home cooked food what your mother is cooking, and they every week they want something different. So do you have any message to the teenagers, like
Yes.
what care they should take?
Yeah, definitely. First is a diet. They should have a proper diet, and they usually have sedentary habits. They just work on.
So I think you should just
laptops.
get up and move.
So they have to move. They have to do exercise, and they are always young people. They are always energetic.
Very true.
If they do, and especially the teenagers who are obese side and they are getting cycle problems, menstrual cycle problems. If they go for workout, they lose weight faster.
Yeah.
Because
True.
so more than their higher age group. So they should try for weight loss. If they should try for regular exercises.
So the common message to the teenagers, I would say teenagers, and even for the adults, even for people who are trying to conceive, I feel regular exercise is a must. Spend time for yourself. Please do not think that you don't have time for exercise. I think that's the worst thing that you can do for your body. So spend time for exercise. Have a healthy lifestyle. Have a healthy eating pattern. If you are so fond of outside, see what happens. I am not telling that don't eat this food or that food. I am never against very interesting pasta or a pizza. But I feel, cook whatever you want to cook it in the house, because you know what ingredients you are putting inside. You are using pure things, and you are aware of the oil or whatever you are using. So I feel, if at all you feel you want to eat some fancy food, okay, cook it on your own. Nowadays you get all recipes on Google. We all are from generation where we are never exposed to pasta and pizza, but I think I make world's best pasta. And you just have to learn healthy cooking. You can log in into Google and you can learn a lot of recipes. So I feel, I'm not saying don't eat interesting food, but stop outside food. Okay, I have heard a lot of instances when people tell they use a lot of ajinomotos for different recipes. They use a lot of baking sodas and soda bicarbs, and the oil also what they are using is the refried oil. We don't know whether, see, in the house we know that we never use the refried oil. So I think it's very important to stop outside food. Okay, eat whatever you want to eat, but eat it, make it on your own, and have it in the house. So that is something very important take home message. And friends, try to lose weight and stay healthy, stay fit. Thank you so much for joining us today for today's program. Thank you, Dr. Swastya. Thank you so much.
Thank you.